Well, good afternoon. When COVID-19 hit, like many businesses, the government had to act quickly to adapt our services to meet the needs of Ontarians. Because they were counting on those services, it's why we temporarily extended validation periods for driver's licenses, health cards, and vehicle registration stickers. We extended the expiry date for marriage licenses to help couples who had to put their lives on hold. We also made it possible to get important documents notarized virtually so businesses could carry on as usual in unusual times. We allowed municipalities to hold council meetings virtually so they could continue their important work on behalf of their communities. We found ways to go digital. We found ways to simplify processes. We found ways to be more responsive and flexible. And as Minister Bethlenfalvy knows well, that important work started as soon as we took office. COVID-19 has accelerated that work, and today we're taking another step in our plans to put people first. I'm proud to announce our all-new action plan to make government services better for people. Whether you're getting married, renewing your driver's license or health card, or filing paperwork for your business, we want to make services more accessible, more reliable, and more convenient for you. From banking to groceries, businesses have adapted their operations to meet their customers' needs online. Government must do the same. Our customer is the taxpayer. We need to deliver the same level of service they've come to expect from other services they rely on every day. Our plan includes over 30 projects to improve government services. We'll bring in more services online, we'll reach people where they already live and work, and we will save them time and money. Some of the key projects include exploring how to make health cards, driver's licenses, and birth certificates digital and stored in a secure digital wallet. This new technology would allow you to securely access new services online, where previously you may have needed to go in person to prove your identity. We're also taking a look on how to buy things more cost-effectively and efficiently across the entire province. I mentioned, I think a few days ago, I spoke about Canadian Tire. At the time, they had 65 people on their procurement team, purchasing team. We have 7,000 people working on procurement across public sector. It's staggering, it's unacceptable, and I promise you we will do better. Centralizing procurement and ordering everything from toilet paper to PPE in bulk will make sense today and beyond. As a family, you go to Costco to save money, buying in bulk. It's time the government did the same. Leveraging our buying power as the Government of Ontario would allow us to save taxpayers between $1 to $2 billion a year to start, with more savings expected in the future. That's billions of dollars more for healthcare, education, and other critical government services. And these are just two of many incredible projects to help modernize our government. Before I pass it over to Minister Bethlenfalvy, I want to share a message with the parents and the kids out there. I know you're looking for more information about what to expect for Halloween this year. We're trying to make it as safe and as simple as possible. My friends, we all know that this isn't going to be a regular Halloween, and the steps we take now will determine what the holiday season looks like this year. We just can't have hundreds of kids showing up at your door if you live in a hotspot, especially in apartment buildings. My friends, we need to work together this Halloween to protect Christmas and the holiday season this year. If you live in a hotspot in Toronto, Ottawa, York, or Peel, we would strongly recommend avoiding door-to-door trick-or-treating this year and finding other safer ways to celebrate with your household. Have a scavenger hunt for candy around the house, carve some pumpkins, put on a scary movie, sit down with the kids that night and have fun. For the other regions, we're asking for additional precautions. If you feel sick, please stay at home. When trick-or-treating, only go out with members of your household. Wear a proper mask. Costume masks are not a replacement. Stay 2 meters apart while waiting for candy. And for people giving out candy, please use tongs or make use of hand sanitizer when handling the candy to trick-or-treaters. By taking these steps, our kids can have a safe and fun Halloween this year. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Bethlenfalvy.
Thank you, Premier Ford, and good afternoon, everyone. I'm pleased to join Premier Ford today to announce Ontario's action plan to deliver more convenient, more reliable, and more accessible programs and services for the people of Ontario. We call it Ontario Onwards. Je suis heureux de me joindre au Premier ministre Ford aujourd'hui pour annoncer le plan d'action de l'Ontario qui rendra programmes et les services plus commodes, plus fiables et plus accessibles pour la population de l'Ontario. Il s'agit du plan Faire progresser l'Ontario. Throughout the pandemic, we know that the world has changed and government must change with it. But change in government is not always easy. It often requires a will and a drive to enable that shift. That is why our government is seizing this moment to deliver government programs and services which meet the public's needs with unprecedented speed and convenience. Ontario Onwards, Ontario's COVID-19 action plan for a people-focused government, is that plan. Building on what we've learned from the pandemic, this action plan includes more than 30 initial projects that will bring major change to government, both in what it does and how it does it. One of our signature projects in the action plan is a digital identity that can allow you to safely hold and use the personal information that's found on physical government IDs online, including driver's licenses, health cards, and birth certificates. Citizens will eventually be able to do more transactions and access more services online, and businesses can be partners in accelerating easier and more convenient interactions for people. Starting in January, the government will consult with industry on how the province could introduce a secure digital identity for Ontarians by the end of 2021, including the strong privacy protections that will make sure you only share what is needed when it's needed. Now, you will need to keep a driver's license or health care card in your real wallet, at least for a little while, but we will start introducing new ways to use your identification online beginning next year. With a digital wallet, your identity is in your hands, on your device, and under your full control. Let me give you a few examples of what might be possible. Let's imagine a small business owner needs to register their new business within the province. With a digital identity, the owner or authorized representative of one of the thousands of new businesses started every year in Ontario could skip one or many trips to an Ontario government office and use their digital ID to register their business online. A student could skip a trip to the bank to open their first account by verifying their identity online. And a senior could check into a doctor's appointment remotely from the parking lot or lobby, maintaining physical distancing and by avoiding the lineup in the waiting room. And here's another example. Each year, approximately 50,000 farm vehicle renewals are processed and can't currently be completed online. With a digital identity, an Ontario farmer could choose to renew their farming vehicles online instead of visiting a Service Ontario location in person. So these are just some possible ways that with a verified digital identity will make interactions with government for people and businesses simpler. With our action plan, we're transforming government, moving Ontario onwards, and putting the people at the center of everything we do. Thank you.
Well, Ivana, before we take questions, I just have to talk about a couple items. So folks, I guess what I'm asking the protesters for, they show up to my house every Saturday morning. This is not about me. I'm out of there, I'm not there. It's about, I got the best neighbors in the entire world. They're absolutely amazing people, but my street is packed with little kids. And when protesters show up at 10 in the morning every Saturday. The kids don't go out and play, and they're always on the street playing road hockey. My neighbors, they're frustrated. And as for my neighbors, they didn't sign up for this. I signed up for it. I signed up to be the premier. God bless them. They want to protest. Please, just come down to Queen's Park. Don't scare the kids in neighborhoods, because you are scaring them. You're intimidating them. The neighbors are frustrated, and I just want to thank my neighbors for their patience. Just to the protesters, I know you don't want to hurt the kids. I know you don't want to intimidate my neighbors, but you're doing it. You know, loudspeakers, everything to the point. Folks, one of the protesters a couple of weeks ago threw blood on the street. It could be fake blood. We had to call the fire department to clean it off the road. It's resources of the Toronto Police, resources of the OPP, and it's just so unnecessary. You want to protest me, God bless you. I'm all for it. Freedom of speech. Come down here, protest, do whatever you want, but just please leave my neighbors and their kids alone, please. The other second item, I'm one of the few elected officials in the country. Everyone seems to have my phone number. And to the folks out there that message me, and thank you, because there's so many people I help when I get these messages, but I'm getting hundreds and hundreds a day, and I just can't return them all, and I apologize for that. I'll do my very, very best. I'll give you an example. One person in the last day and a half have messaged me 15 times. I can't help people when I'm getting 15 messages, and I'm getting hundreds and hundreds, and I've helped numerous people just over the weekend, but I just can't keep up. So if it's an emergency, and I really appreciate you getting in contact with me, I will get back to you. I just may need a day or two, because they're coming in so fast and furious. I just can't keep up, and I always believe in returning every message. So the more people message me that over meaningless stuff, then I can't take care of the people that need my help. So just please, I appreciate the messages, I appreciate the calls, but just please have patience. So those are my two items there, and I'll take questions now.
We'll go to the phone line.
And one other thing, I just want to talk about the dance studios. We're doing everything I can, working with Dr. Williams and the health table. I know Cabinet will be discussing this afternoon, and we'll have more to say after that, but I'm a big supporter of the dance studios. So we'll be ready for questions.
Okay, we'll go to the phone line. First question, please.
First question comes from Haley Cooper at News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. We wanted to talk about Halloween. So parents have already come up with creative solutions for Halloween. We've seen candy chutes created that allows for proper physical distancing. We've heard plans to leave candy bowls at the end of the driveway, again allowing for physical distancing, or in condo buildings, oftentimes they have candy pickup in the lobby. So that could easily be staggered by giving floors a specific time to come downstairs. So what is really going on here? What's behind this decision recommending trick-or-treating be canceled in hotspots?
Well, before I pass it over to Dr. Williams, I just have to tell you, I'm not canceling Halloween. What we're asking, please, the kids just don't go door to door in the hotspots. I know I have 4 kids, and when they grew up, Halloween, it's huge. It was huge when we all grew up, and it's tough, but I just can't have, like in our house, we have 100 kids, and you know, it's not safe right now. It just isn't safe to have. And as for the apartments, you know, I used to be down at the apartments up in Rexdale, and they'd have it in the lobby, and you'd have 50 kids jammed in there getting in. A lot of apartments don't have that. They go door to door. So, you know, having all the kids lined up in the lobby, it's not safe. But please, celebrate Halloween. Just celebrate it in different ways. As I mentioned, you know, do the pumpkin carving, have fun at home. You know, you think I like doing this? I hate doing this. You know, Halloween's important. The kids, it means everything. And I don't like doing this, but we have to do it to keep everyone safe. I'll pass it to Dr. Williams.
Yes, well, thank you, Premier, and I agree. It's not something that we want to do, But we know that with the evidence we see with lots of community transmission, we're talking about especially those areas that are in the modified 2 level, that's Toronto, York, Peel, and Ottawa, that we're concerned with the level of community transmission at this time, to have extra caution and to say that we're recommending not to celebrate in the normal door-to-door way. We've given some suggestions in our media, only some ideas that you could do, and to undertake that. The rest of Ontario, we've given, as the Premier's already noted, other recommendations to try and make it a safe process, and that very much parental supervision is necessary, because you're dealing with a lot of different people interacting in many different ways, and we've seen that go awry before, even with our social circles. And so we have checked with the 4 medical officers of health in the areas I've noted, and they're all strongly concurrent with our recommendations. They may take some steps to make something slightly more stringent. I'm not sure they will. And some around the outside have also thought they might want to imitate that. But right now, we're only recommending for those 4 in those zones. And there's things you can do, and I know that people say they have ideas and creative thoughts. The trouble is, how does that going to happen consistently everywhere and every place that everyone's going to be notified of? And with public health right now, with tracking down our cases and contacts in those high zones is a complex issue. And remember, most of the time, and as the Premier said, having had children of my own and having grandchildren that are going to be disappointed to some extent, I know there's going to be some school activities they're going to be involved in. This is really an event I've always felt was mostly strongly for the younger ones. And they can do things to make it fun with virtual Halloween in different areas, family members dropping off beforehand loot bags or packages carefully, safely at the doorstep. And you can do things in exchange and make it fun for them at the same time. And everybody gets to see online their costumes and how they're dressed up without having to walk around in the cold and the rain. And I always remember one time when I was in Northern Ontario, we had to close down at 7 o'clock because of 1.5 feet of snow. So some things are just happen that way, and you still make the best of it. So we want everybody to be safe and healthy. Because of Chairman, we want our children to be safe and healthy, because a lot of them are going back to school the next day. And we want everybody to be at school and to attend as much as possible. So be safe, have fun, but do it in a very careful way.
Follow-up?
Thank you. And my follow-up is still sticking with Halloween.
Sure.
You've been emphasizing the importance of proper physical distancing and masking and encouraging people to get outdoors, but that's not allowed for trick-or-treating. We're just trying to square this. How can people be allowed to gather on patios, eating and drinking? Neither of the food that's served on patios or the drinks are prepackaged, but kids can't walk with their parents outside in a full costume and have pieces of prepackaged candy fall into a bag.
Here, Haley, I hear you. Believe me, I don't want to be the bad guy out there that says kids can't go trick-or-treating. I don't want that. As I won't mention, but one of the mayors said, hey, at least I don't have to be the bad guy that has to cancel Halloween. You do. Like, I don't want to be doing that. Believe me. But when you have the kids going up, and the groups may go up 4 or 5, and you're sticking your hand in the candy jar and then handing it over. A lot of times, what we would do, we hand out the container and say, okay, kids, take what you want. They're sticking their hands in. I'm just following the health advice. I'm following the doc's advice. I'm following all the chief medical officers' advice locally. Toronto doesn't want it. Peel doesn't want it. York doesn't want it. Ottawa doesn't want it. What can I do? I can't go up there and say, okay, forget docs. I'm not listening to you. All the kids go out there and go door to door, stick your hands in those bags, and God willing, God forbid something happens. I just can't chance it. I'm not canceling Halloween. Let's just not go door to door in the hotspot areas, because those regions, I counted up, make up out of all the cases. The vast majority, I think it was 90% between those 4 regions, and the rest of the province, which is massive, is okay. But that's what I got to say about that. I feel terrible. I do. Just terrible about it.
Next question.
Next question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. I'd like to hear from yourself and from Dr. Williams on this. I get you don't want to be the bad guy on Halloween.
Yeah.
Fully understand that. But we keep being told that you've got to be in close contact with someone for 10 to 15 minutes to contract COVID-19. Then, you're effectively canceling Halloween. You're telling people not to go trick-or-treating. You said that you wouldn't close bars or restaurants without hard data in front of you.
Mm-hmm.
Whether it's Halloween or it's the bars and restaurants, neither you nor Dr. Williams has shown us the actual work that connects the transmission of COVID-19 to trick-or-treating or to bars and restaurants. So is your public policy being driven by fear, either from you and your cabinet ministers or from Dr. Williams or, medical officers of health in respective communities? Because if it takes 10 to 15 minutes of close contact to contract COVID-19, how on earth do you get it from trick-or-treating door to door?
Okay, Brian, I'm no doc. Before I pass it over to him, what I'm taking that you may think it's all right for the kids to go out door to door, even if they go to seniors' homes or whatever. They stick their hand in the basket. Kids are sneezing, wiping their nose, doing everything, and out in the cold, and then they stick their hand in there and they pass it over. Brian, I'm just going by the health advice. That's what I'm doing, and I will always do that. And it's not based on fear. It's not based on my cabinet. It's based on the medical advice that I get, not just from Dr. Williams, the whole team. As Dr. Brown said, under each one of these docs, there's 70 other docs, and by the way, vast majority are all volunteering their time to give advice. So I have two choices. Either forget about the docs and ignore them, everyone just go hog wild and join the 4,000 maskers that went down in Dundas Square, and God knows what was spread down there. Or we take little precautions and we just be safe with each other. That's all we're doing. Don't cancel Halloween. Have fun. Do something else. That's all I'm saying. I'll pass to the doc.
Yes, well, I think you have to look at, you said, where's the evidence from trick-or-treating? This is the first Halloween we've had with COVID, so there's not a lot of track record globally on this matter. The point is the collective activity. And if you've forgotten what Halloween was like, I still remember what it was like and what my kids are like, especially some that are over the age of 5 or 6. They go around in groups of 8 or 9, sometimes smaller. Every time they finish, they get together in a huddle, they share stuff, they say, okay, I'll give you some of mine, back and forth. There's a lot of chatter and close contact, and sometimes with adults too at the same time. In all that enthusiasm, it's really hard to contain that and control that. And so we want to make sure that, because they're not in the same cohorts as they are in their classrooms. So we're trying to maintain those cohorts going to their classrooms to keep our schools open, especially in those zones where we have most of the school cases coming in are from those hot zones there. So we don't want to encourage that because we want to keep our schools open. Some of the younger ones, yes, they're going to wear their costume to school that day. They're going to have fun. There's lots of things they can do. But we're trying to say in those hot zone areas, we don't want the historical version of groups of piles of kids running around from neighborhood to neighborhood, and they're congregating, they're gathering, they're sometimes talking to adults in different groups. There's very little control over it. And I understand that. It's just the enthusiasm. They get carried away with, what did you get? What did I get? And they're looking at each other's bags, and they're within about a foot of each other and exchanging, and that's just what goes on. So we know that evidence. We want to have precautions because we want to get through Halloween, move on to Christmas and holiday seasons, but we want to keep our schools open and keep those cohorts as healthy as we can with less transmission down to 0. So that's why we're making the recommendations.
Follow-up?
The issue of shutting down bars and restaurants, Premier, you have effectively made a bunch of people unemployed. You have set up so that a bunch of business owners no longer have income. And yes, they can rely on federal programs, but that does not replace what they were making before. At the same time, neither you nor Minister Bethlenfalvy nor Dr. Williams have seen, none of the people making these decisions have seen any impact on their income at all. And I'm wondering, have you looked further into the fact that while there are many civil servants who are working above and beyond what they normally would during the pandemic, there are others, because of the nature of their jobs, have not been able to work while they're at home, and yet they have been receiving their entire paycheck the entire time. How is it fair for you to shut down private businesses and tell them that you need to bear the brunt of this while keeping civil servants who have not been working because they can't do their jobs from home on full pay?
Well, before I pass it over to Minister Bethlenfalvy, You know, Brian, I've talked to so many restaurant owners, and it's terrible. You're 100% right. Even though we're giving $300 million, we're paying with the feds 90% of the rent, paying 65% of their wages. Nothing's better than keeping the doors open to have people sit in there. And I've talked to restaurant owners over the weekend, and these are the people we're trying to help with everything we possibly can. But again, you know, COVID sucks. What can I say? It's terrible. It's just a terrible, terrible thing, and it's not fair to any single person. And as for the public service, they are working. They're working from home, and we try to bring them back until we hit the second wave again, but they're still working at home. And as for wages, you mentioned it. I might as well mention it. I've kept it. I haven't told anyone any of this, but you know, I know it's not much. It's peanuts, but I gave back $10,000 of my salary, 10% of my MPP salary, along with the Minister of Finance. I haven't advertised that. We did it months ago, and you know, when I was a councillor, I gave back 4 years of my salary. It's not about my salary. I understand what you're saying. Government workers are getting paid, and other people are struggling. These people, the government workers, they're still working from home, as a lot of people are, and I want to get everyone back. Believe me, I do. I'll pass it over to Minister Bethlenfalvy.
Thank you, Premier, and thank you, Brian, for the question. You know, it has been a hard time for everybody in this province. I work closely with the Premier, and I can see him work 24/7 to keep people safe. And I know how difficult it is for him to have to make these decisions along with the rest of us, as well as Dr. Williams. I can say the same thing about the Ontario Public Service. 60% are at the workplace. There are many who continued working right through the pandemic. Our Ontario Provincial Police, our corrections officers, many in the Ministry of Natural Resources, Environment. I can also tell you those who work remotely, many of whom work in Treasury Board, for example. We've had more meetings in the last 7 months than we typically have in a 2-year period. Every one of those meetings requires preparation of materials so that we can make informed decisions that matter to the people's lives. You know, the healthcare system. I was up here last week talking about how we would spare no expense to provide the firepower to our Minister of Health, to our Premier, because that is our priority. And the better that we do on the healthcare side, the better chances we've got with the economy. So we're all in this together, and I'm very proud to work with the many people at the Ontario Public Service. Thank you.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. I'm just wondering, back to Halloween, just for a quick question before I move on. Sure. There's some pushback from doctors on this, on social media, some infectious disease doctors and whatnot, who are normally in favor of more restrictions. So how do you parse that? Do you think you've gone too far? And they do talk about inconsistencies, such as, you know, you can have lunch on a patio with people you don't live with, but kids can't go to door-to-door trick-or-treating. So how are you going to square that?
It's about limiting, you know, the spread. That's what it is. Again, as Dr. Williams said, we haven't went through this when there's Halloween, and you know, we have the best docs in the world right here in Canada, and the docs are human beings too. They aren't all going to agree, but I can line up probably hundreds, if not thousands, that agree with, you know, moving forward in a very cautious way. And of course, if I dig deep enough, I'll find docs that are great docs that may not agree. But you know, at the end of the day, I have to rely on my Chief Medical Officer of Health, Dr. Williams, the health team, all the 34 Chief Medical Officers around the province, and I'm going to take their advice. All the other advice is welcome, but I got to listen to the docs that are on the health table.
Follow-up?
Yeah, just to the Premier and maybe over to Dr. Williams on this too. You were both talking about we need to be careful on Halloween to increase the odds that we might be able to do some family gatherings at Christmas. So given where we are now, where are we going to have to be, and when are we going to have to meet those targets in order for Christmas to be clear? Do we need under 200 cases a day? Like, what do we need? Case positivity rates below 1.5%. I'm just looking for some benchmarks for allowing things to happen at Christmas.
Yeah, that's a good question, Rob. And I wish I had a crystal ball. What are we, about 65 days away from Christmas or there and abouts, and the holiday season? And I wish I had a crystal ball to say where we were. Let's reverse back 60 days where we're at. 60 days, we were seeing the numbers drop. We were getting below 100, trying to get life back to normal. And all of a sudden it just came back. But it's not just here, it's all over the world. And if you look at 100,000 cases around the country, you know, Quebec's way ahead of us with, I think, 109, and Alberta's ahead of us, and Manitoba's ahead of us, and I think I got the numbers here. Here we are here. Ontario has the lowest active rates of COVID cases per 100,000 people in Canada, one of the lowest. BC's lower. But compared to Quebec at 104, Manitoba 122, and Alberta at 65, much smaller provinces, and we have 41 cases compared to theirs. We must be doing something right, you know, everyone. And when I say we, I always say the people of Ontario. It's not just the government. So I'll pass it over to Dr. Williams.
Yes, and Rob, it's a good question. We're looking at right now, how do we beat down the second wave? We're taking strident measures to try and do that. We have sensed that our numbers are not as high as was predicted by the modelers if we took no measures. We have taken some measures, and we're seeing some evidence of plateauing. We're not out of it yet. We've given the 28 days with the first group of the hot zone ones, and then now York 1 week later. We would like to see that down quite a bit. As the Premier said, it's still 65 days out. A lot's happening. We're in a global reality. A lot of things happening. It's winter time. We haven't had COVID in the depths of winter. We came out of the winter into the spring. Now we're going into it. We haven't got through our flu season yet and other respiratory viruses. And having all these aspects, schools and everything open during the whole time. I'd like to be optimistic and think that we can beat this one down and get to a number where we can feel with a composite is a safe zone. I know the Premier's noted that our rate per 100,000 is less than the others. Nevertheless, we have some of the highest population in Canada and the highest centers of dense urban population, so we have to be extra careful before we open things up. But let's get this done first, and let's see if we can keep this going. That's why we're doing the measures around Halloween and the other steps of the modified stage 2 to see if we can get back down to what we're experiencing more during the summertime. But it's not summertime, it's winter, and so we're going to have to keep that in mind and see how we experience that and how well we can do what we've done so well so far, and everybody steps up to the task as Ontarians and see if we can bring this under control to help us prepare to see if we can have probably a slightly different but a good festive season.
Next question.
And the
Next
other
question.
thing, actually, before I just want to follow up with Dr. Williams, the other thing, Rob, that's going to help tremendously, it's just one tool out of many measures, because there's multiple measures that we can take, but I think one area that's going to be a game changer for all of us is when we get the rapid test and the antigen test that we can find out in 10, 15 minutes, and we're waiting for delivery on that. I personally think that's going to be a big game changer. Not everything, but it's going to really, really help us. Imagine getting a test and either you're going into the place or you aren't going in, and we'll be able to narrow it down. So I think that will be one of the tools that will help us within the next 60 days.
Next question.
Next question comes from Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Graham.
Hi, Premier. Many months ago, I think I remember you saying your nephew asked, hey, Uncle Doug, can I go
Yes,
to
I
summer
remember.
camp? And you
Yeah.
didn't know. And I think a lot of people are struggling with trying to predict where this thing is going. Looking back on that, have you given up trying to predict where we're going? Because with my family, I have, because I was so optimistic in the summer, and now that's gone away. And I think a lot of people are in the same boat. Did you expect us to be here at this point in time?
Well, I can tell you, I'll never give up. I'll never give up on the people of Ontario. I'll fight this thing right to the end, and I encourage everyone, never, ever give up. We will win. We will get through this. We'll have some bumps in the road, but I just wish I had the crystal ball to see where we're going to be in 60 days. You know, everyone talked about the second wave. We see it around the world. It's affecting so many people. You see shutdowns in Italy, now Germany. So, you know, everyone talked about Germany. Now they're going backwards, and Netherlands and the whole group over there. The UK, it's running rampant down there. You look at south of the border. So with the help of all the medical advice and the 14.5 million people in Ontario, you know, I think all of us, 14.5 million people, done an incredible job getting through a real bad situation, because there's a lot of really worst cases all over the world, and even some worse scenarios in our own country and south of the border. So, you know, we're doing everything, sparing no expense, pulling out every resource we can to get us through this, and we will get through it. We will get through it.
Follow-up.
Just can I ask Dr. Williams for some specificity here? You've just said we've seen some plateauing. What does that mean, numbers-wise? Mm-hmm. And if you don't want to say what the number is, I understand that, but when you say we're seeing plateauing, to Rob's question, what do we have to get get better than plateauing? Or are you reluctant to say that because you think the public will relax too much?
No, what I was saying is that when we sat down with the technical briefing and we looked at where we were before we introduced any of the measures, as on the 19th of September, the 25th of September, and the 2nd of October, and again with our modified stage 2, they said if we didn't amend things the rate we were going to be doubling every 12 to 14 days. They actually said 10 to 12, which means that by now we would be at 12 to 1,400 cases a day. Toronto also said, with their review of their epidemiology, that when they had 300, they would be doubling every 6 days. Neither of us, fortunately, have seen that. Measures have been taken. They've dropped that down. So the last number of days, we've been under 700, up to 8, down to 6, as upper 6s, and we're going to see if we can keep that. So it means we're not doubling every 10 to 12 days. So that's what I mean by plateauing. It's exactly identical each day. It isn't. But what I like to see is that number coming down, and we did that in the first wave. It doesn't come down as fast as it goes up, but we watched that all the way through May into June of going down into the hundreds or the 200s and the hundreds. And I think we can do that again in our positivity. Decrease the community transmission. And I don't say that as just a nice note. That's what we need to do. I think we can do it. We did it once. We can do it again. I think the other thing is that we all want to bring it down, and we're not trying to keep people on that edge. Public health officials, if anyone would like the pandemic to be over because they want to get back to other public health programs that are just as important, child health and nutrition and education and things around health promotion, all those aspects are critical. We have to keep going at. So I think we can, and we're on a global route here with everybody else, our partners, and we're watching each other and learning from each other. This is everybody's first time around at a second wave, and we want to see how things are changing. It is a virus. It moves along wide population groups. Very many variables playing in here. So we're trying to keep track of that, keep you advised as best as possible. So it's coming down. If you hear me being enthusiastic again, as Rob was saying before, we'll be looking forward to announcing those lower numbers and getting into a safer zone. So again, as I always said before, stay tuned, and everybody just keep doing what you need to do, because collectively we did it once, we can do it again.
Last question.
Last question comes from Travis Danrash at Global News. Please go ahead.
Hi, Travis.
Hi there, Premier. I'm just wondering if you kind of understand why people are confused by the public health advice coming out of this government sometimes. I know that you defer to Dr. Williams in the health table, But on Halloween, like, kids are in school right now. They're sharing books, they're sharing toys and other learning tools in the classroom. Thanksgiving, group gatherings were allowed to be 10 and under. You could also invite one other person from another household to your home if they were single. How does that make sense? But trick-or-treating is not acceptable. And do you get that people are confused by this advice, which seems to be all over the place sometimes?
Well, Travis, I appreciate the question. I will pass it to Dr. Williams, but before that, I don't need to be a doctor to know that, you know, the schools are in cohorts, and Halloween, you're out with a bunch of kids, and you're going to hundreds of homes. We'd be out for 2 hours when we were younger. We'd be trading in our pillowcase, grabbing another one, going out and being interactive with doors and houses and people. And, you know, I just, again, I think it's about as clear as you could be. It's not the safest thing to do right at this point. Now, on the other note, if we did let people go out and all of a sudden numbers spiked up, guess what? You'd be blaming this guy, saying, why would you ever let those kids go out door to door? And there were seniors answering the doors, and have you lost your mind, and this and that. So, like, sometimes you just can't win, but I got to err on the side of caution and protect the kids and protect the seniors. I want to hand out the kids candy, and I think it's about as clear as you can get, but I'll pass it to Dr. Williams.
Well, thank you, Premier. Those are all excellent points. And I think if we tried to address the message, we're trying to keep our messages consistent. And I really can't agree with your comment that we're inconsistent in there. We did say around the different aspects and times. The social distancing is the same. The cohorting in the schools. The toys and books and things, there's really strict cleaning processes in place there. The education system is doing a fantastic job of holding that together and doing well on that. They're asking the children to mask in certain settings. So that is going very well. And I don't want to detract and unrail that type of excellent process. So at the moment, we only have 4 schools closed in the province of Ontario. That's amazing when you think of the size and the immensity of it. At the same time, I think around the Thanksgiving one, we were very clear on what we said. And I think what happens sometimes is that people make comments and they get quotes from the media, from different experts, A, B, and D, and I probably said, well, he said and she said. And I said, well, did you look at the webpage of Ontario? I said, no, I haven't really got time for that. And our messaging is really quite clear. We try to make it clear. It's there for your reading. And I think what's confusing is we have a lot of people weighing in with their own version of what they think is correct. But we'd ask you to go to our web pages and look at those sites for the messaging. And if there's something that's really confusing, do let us know, and we will seek to get that straightened out. But the thing is that these are all different activities, different settings, and we're trying to make it as clear as we can, yet being flexible and understanding that you have to make some, as the Premier was alluding to earlier, when we put in some steps around gymnasiums, we were brought to made awareness that there's some issues with dance studios. Okay, so what are we going to do with that one? So we have to understand these different nuances and deal with it. Why? Because it means a big thing for some people. That means there's going to be some other variations in there. You'll have to go to our webpage with the Ontario site to look for the true direction. And if there's questions, ask your local public health for interpretation, or ask us, and we'll seek to uncover or deal with any uncertainties that you may have or confusion that you may see or read in there. But often I find it's often countering what sometimes they've heard out in the public or on social media from an expert in area A, B, or X and Y, and that's getting the public confused. But some experts are really good and consistent on it, and I applaud them for that, because we all have to be on the same page in this one.
Follow-up?
Yeah, I will point out that there are 483 schools with a reported case of COVID right now. But on going back to what you're talking about at the start of the news conference, Premier, these protesters showing up at your home and intimidating your neighbors, etc., and what happened at Yonge and Dundas Square this weekend. Can you tell me a little bit about why we're still allowing these large group gatherings to occur when they are, you know, obviously not following public health guidelines? They're also spreading misinformation. And do you think, and should we be cracking down on these gatherings more?
Yeah, really good question, Travis. I'm a big believer of freedom of speech. I really am. But again, we're if I can say it this way, we're Canadian. There's certain lines you don't cross over. And there was always a line, and I'll speak on behalf of other elected officials, be it the former Premier, Kathleen Wynne, when the protester in front of her place, or Mayor Tory. And it's not about Mayor Tory, Doug Ford, Kathleen Wynne. It's when they go into Mayor Tory's building, everyone has to show ID now. That's not fair. They didn't sign up for that. My neighbors never signed up for it. You have two options. You kind of, move them along, and especially in a large group, the other smaller groups, you can kind of move them along. But the 4,000 people, it just wouldn't be a good situation. You gotta work with us. There's 4,000 people. It'd be, in my opinion, it would be tough. Our police resources are stretched all over the place. We need a few hundred police to go down there and clear them out. For what? Because they want to protest not wearing a mask and want to go out there. I just pray to God that these people never get sick, and the severity. They might not hear the stories I hear, and the public might not hear that I hear. Some people can get through it. Some people are really, really get sick, and it's not just about elderly people. Younger people too are getting really sick, and then. What happens 6 months down the road? Does this still stick with them, and they aren't 100%, and the research just isn't there? So guys, come on, I get your point, believe me. And if you're going to do the protest, which I adamant about, do not do it, because you're putting everyone in jeopardy. If you don't care about yourselves, then care about the rest of the population. Care about the healthcare workers, care about the docs and everyone pitching in, and care about your grandparents and your parents. It's unfortunate, but we live in a democracy, freedom of speech, but you shouldn't try to intimidate people. We just don't do that. As I say, Travis, you know this. There's an unwritten rule in politics. I respect it. All the opposition people expect it, no matter what party. We're open game. We signed up for it. What are off limits are families. It's just an unwritten rule. You don't go after the families. Everyone knows that. So to the protesters, I ask you again, please don't intimidate the kids and the neighbors. Come down here, do cartwheels, jump up and down, do whatever you want. Come to my office. I don't care, but not the kids. Anyways, thanks so much, everyone.
Thank you,
Thank you.
everyone.
Thank you.